Well, good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXPX. My name is Paul Thomas. With us, as always, is Mr. Bill Kearney of Northlake Medical Pharmacies. And Bill, it's kind of crazy to think, but by this time next week, we'll have a new president.
I know, and it is the stress that's going on with people.
Yeah,
and
people are stressed out.
And depression, and it's something that it's like nothing's in order now. You know, everything's just kind of up. I was in the city yesterday and made it to a doctor's appointment at CPMC and was coming back, and I was almost at the turnoff for Highway 12, and I put my turn signal on to turn. And I was halfway in the lane, and here this lady came up right in my lane, almost hit me. I swerved to miss her, and the person was coming up on my other side was honking his horn, and I thought, my gosh, I went all the way through the city, and I thought everything was okay, and then I found out I left my cell phone there in the doctor's office, and I thought, I need to stay in Lake County, and
that stuff happens when you leave the comfort zone.
Yeah, it is. It does. I sponsored a bass tournament this weekend out at Canacte Vista for it's called Soldier's Wish, and I was talking to some of the guys who'd come from smaller areas and had said what a beautiful place we have here, and the traffic that they had to deal with in leaving their community to come here, and it is a relief, but there isn't anything that we're spared from when it comes to this electoral process that we're going through. And I had on the news today coming in here, and I thought, this is just depressing me. So I bought, I listened to audiobooks in my car, and I put a CD in there and started listening to that, and at least took me into a different world. But there's a lot to think about, and health care is one of the focuses of the election that's going on. The Trump campaign Republicans want to get rid of Obamacare. The Hillary wants to keep it. However, we talked to people in the last week or so, and I've been traveling to Louisiana and Illinois and Southern California, and that are with Obamacare, where their rates are going up sometimes 60 to 65%, and it's not affordable. And of course, the hope for Obamacare was that the young people who didn't really need a lot of health care at this time would pay the higher premiums, even though they wouldn't use them, and that would make it less expensive for the people that are really sick. Well, that did not happen. You have states that took on the state program of what's it called here in California?
Covered California?
Right, Covered California. Yeah. And those rates are going up considerably too, plus not just the premiums but the co-pays. I just give all my employees pay for their insurance, and found out that on the particular insurance plan I have, that Sutter Health in Lake County is covered, but if you go to Sonoma County or San Francisco County, it isn't covered. And of course, the premiums have gone up, the co-pays have gone up, and we just don't really know. I was speaking with a store in Los Angeles yesterday that I'm trying to bring into our co-op. Big store, 90,000 square feet, and the guy is trying to survive doing the amount of prescriptions he has, and looking for some way to continue to fill prescriptions without our reimbursements. Every time there's they're focusing on the cost of prescription care, of course, and when you do that, you have a tendency to take away from the people that are giving you the prescription, which are the pharmacies. And of course, pharmacies that are independent, that don't have huge front ends, aren't able to survive the profit loss that's going to occur. And so many times they join a co-op or some sort of an organization that will give them a rebate program on at least generic manufacturers so they can continue to survive. But it's going to be really important in the future, and I've told people many times. I've been giving many kinds of presentations to different groups. I'm giving one to the women's group, civic group at the Clear Lake Riviera Friday afternoon. And, of course, one of the things we will be talking about is the election. And the two propositions that are most affected by our business, of course, is 52, which has to do with whether hospitals will continue to do Medicaid or Medi-Cal. They do take Medi-Cal and Medicaid now. For years, they've been getting a matching fund up to $3 billion from the federal government that will allow them to continue to process Medi-Cal prescriptions and not be at a complete loss. So if that Proposition 52 does not go through, there isn't, first of all, you must know there's nothing on in the endorsement of these that doesn't have the support of the Republican Party and the Democratic Party. It's a bipartisan support. Every hospital in California supports it. Anybody involved with health care would support it because we want Medi-Cal people to at least be able to go to the hospital and get treatment and not for the hospitals to lose because of it. And this allows the federal government to continue to provide matching funds for the hospital to continue to take care of those people. That's 52, and a yes would be the appropriate vote on that. The next one that's rather confusing is Proposition 61. And 61 has to do with whether or not the drug manufacturers can raise the cost of drugs paid for by the state of California. Now, this is usually employees, prisoners, some other than private people that are getting their prescriptions. So in the very first part of this campaign, you would see the veterans getting up and saying, vote yes on Proposition 61 so our drug costs do not go up. Now you will see all the veterans groups doing a 180 and saying, please vote no on 61. The reason is this is not the prescriptions that you and I get, and I'm a veteran. These are the prescriptions that are paid for by the state of California. I know, because of the profession I'm in, that the cost for veterans that the state pays for veterans drugs right now are the cheapest rate that anybody pays. Even if they were raised 5 or 10%, they still wouldn't be paid for by the individual. They would be paid for by the state. I don't think any drug company out there, considering the openness and the exposure to veterans being not taken care of by our government, would raise the price of veterans' medications, number one. Number two, we're talking about 12% of the population of California. 88% of the population would not be affected one way or the other. So, and if you'll read the explanations behind the proposition, they will not give you a cost on what this would cost the state government or what it would benefit the individual groups that are concerned. Now, I noticed one or two ads on television that do give you a price, but when I evaluated this for the Chamber of Commerce, I said it's kind of roll the dice as far as I'm concerned. I'm a vet. I pay for my medications, though, through my insurance company, and I don't think veterans would be in any jeopardy by voting no on Proposition 61. So it's kind of up to you as an individual and up to your family on what you want to do, but it's a marginal thing as far as the financial effect it would have on the government or the financial effect it would have on veterans. But that's just one part of the election. That's the part that I have been involved with and talking to people about. I'm more concerned with our health the way it is right now. Flu is going to be getting here soon. If you haven't gotten your flu, immunization, get it as soon as you can. We're way ahead of last year in immunizations as far as people getting their flu immunizations early. It's not considered early now. November, December is when it usually hits and carries you through until April. So the one misconception that many people have is that you can get sick when you get the flu. I mean, the flu shot does come with some side effects, possibly, but they don't compare to the flu symptoms. It's no secret that it was designed to help protect you from getting sick from the flu. But you can get a small swelling at the site of the injection, depending on how uptight you are when you get the medication, get the immunization. So it could cause some serious complications for the very young and the very old if you get the flu. We know that within the influenza vaccine is a form of the flu, but the chances that shot can leave you sicker than before is really almost impossible. Each flu shot protects against 3 to 4 viruses. We do a trivalent shot right now. Next year we'll be doing a quadrivalent. That means there are 3 viruses that are inactivated that are injected into you to set up immunity. And every once in a while a person will come in contact with a strain that their shot doesn't protect them from. That's what happened when we did the flu mist. In the last 2 years, it wasn't anything that was going to provide you any immunity. I just had a little girl last Friday or last Monday that needed a shot, and she was 12 years old, and she wanted the flu mist, and I told her I couldn't get it, and she was crying, and we were able to give her an immunization in the arm, and as soon as it was over, she laughed. I told her how brave she was, and her daddy was with her, and then one of my employees had brought in a little puppy dog and showed her the little puppy, and all of a sudden she'd forgotten she'd ever had a shot. So the vaccine is made from an inactivated virus, which means it's not even able to transmit infection. So people who do get sick have been contaminated before they've gotten their vaccine. The vaccine takes 1 to 2 weeks to kick in before it's in full force, although you get some effect immediately. And because it mutates each year, that means it changes. That means the viruses that were good last year probably aren't good this year. Last year was a good example of it not changing. That's the first time since I've been giving flu shots that it's the same as it's always been. It's important to get the new shot to protect yourself from the strains that are circulating and most likely to outbreak in the current season. You can get a headache, you can get a nausea. There are extreme reactions that are reported each flu season, and though rare, have been considered a problem at times, but about 2% of those who are vaccinated experience a real type of a side effect. You're more likely to die from getting the flu than experiencing an adverse effect from the flu vaccine. So it isn't a live vaccine. It's an inactivated vaccine, so it's impossible for you to get the flu from the shot. So if you haven't been immunized, come in and get it. If you're over 60, 65 years old, you need to look at getting. If you haven't gotten 2 pneumonia shots in your lifetime, you need to get the second one, which is either Prevnar 13 or Pneumovax 23. We will ask you about that when you come in if you're of that age group. And Zostavax, of course, for the shingles, if you're exposed to or you think you're more susceptible at that age, of course, to get the shingles. And, of course, we give tetanus, we give hepatitis, we give all the shots that you would possibly need except yellow fever. So our number is 263-5252 if you have any questions. Be sure and ask us. Remember, the holiday is coming up, so you're going to have to think about eating healthy. We have
our annual Thanksgiving show.
Yeah. Where we talk about Paul and I will talk about what we're not supposed to eat, and then we talk about what we're really having. So it hasn't been a diet type show, but it's
hey, it's one time a year where we get to really,
that's right.
pig out on the.
I've got and we're going up to my daughter's in Rockland for Thanksgiving, but we're taking the turkey because I want to make sure.
I was going to say, who's going to deep fry the turkey or barbecue?
Well,
what do you guys do? You do both, right?
We have. We don't do it in other people's homes.
You burn your house.
Yeah, I don't want to see it can get out of hand, but it's a quick way to do it. You don't have to spend a whole lot of time.
I tried to convince my wife about doing the turkey on the barbecue this year, because we're doing Thanksgiving at my house to free up the oven space for all the other stuff. And she's like, no, I don't want to do it. She needs to be in control of the basting of the turkey to make sure.
Well, that's kind of the way, we do turkey 3 or 4 times a year, and other than Thanksgiving, I do it on the barbecue, because I baste it with about every half hour with garlic salt and pepper and butter or a vegetable oil, so it really seals
keeps it moist.
Yeah, the moisture.
I think it'd be a great way to do it.
But
I mean, how long are you doing it? 3 or 4 hours out there?
Yeah.
Oh, yeah.
Yeah.
On a low, on an indirect heat or
indirect heat. Yeah.
And you don't flip it. I mean, obviously.
No, I just leave it there, and I get the baster and some of the juices that go down in the pan. I have a pan that I put it in, and I just keep basting it.
Is it one of the disposable foil pans, or do you have like an actual roasting pan?
I do it both ways, depending on the size. My wife has a tendency to buy these 20-some-pound turkeys, so you kind of have to almost have a bathtub to put it in. So I usually, if it's a heavy turkey and you put it in one of those little aluminum pans and you go to take it out of there,
they'll just
fall
right
all
through.
So anyway, we'll talk about that next week.
Yeah, all right.
Today we're going to be talking about gender differences. You've heard us talk about gender differences when it comes to medication, and until 1994 there wasn't a way to determine how a female would react to diseases or to medications, because we use strictly males to get results from medications and diseases. Now we have females as well, and we're finding some big differences. Colon cancer, which was one of my problems in the past, occurs earlier in men than women. About 35% more men than women are diagnosed with and die from colon cancer. They also tend to get the disease at a younger age. I happened to be, it was 13 years ago, so that meant I was 60 or 61. One factor, we think female hormones, estrogens and progesterones may be more protective. And the symptoms differ. Both men and women have symptoms such as rectal bleeding and diarrhea or constipation, but after that it begins to change, and women are slightly more likely to have tumors located on the right side of their colon. Those cancers tend to be more aggressive. And care, whether it differs or not, people should start screening at age 50, but men are more likely to delay testing because we're men. If it wasn't for the symptoms that I had early, I probably wouldn't have tested. People put it off because they find it embarrassing, and as a result, cancers aren't found till later stages. You go to have a colonoscopy now. They give you a shot of Versed and some fentanyl, and you're out. You wake up, you're laying there with your butt exposed, and you're feeling they're violating me, and then you wake up and you say, when are you going to do it? It's already been done.
So they don't give you they don't put you on gas. It's just a shot.
Just a shot.
Just a shot.
It's been a while since I'm due to have another colonoscopy. When they found my cancer, I had one colonoscopy and they didn't find it, and then I started having more symptoms, and they did find it. And then I was having a colonoscopy every 60 days. So I got to where I wouldn't even take the Versed because I didn't want to be incapacitated for a day. So I let them go in and just cut out the polyps raw they said, well, what are we supposed to do in post surgery? And I says, you don't do anything. You just let me go home. I didn't have any anesthesia. It's just,
What?
so it wasn't,
Ouch.
time is our most important element. So I've had enough pain that it didn't bother me too much. Heart attacks are mostly overlooked in women in the very beginning because they tend to strike women later in life, an average age of 72 compared with 65 for men, but they tend to be deadlier. 26% of women age 45 and older die in the year after their first heart attack compared with 19% of the men. The symptoms we've talked about before, they change. They are often present with more subtle signs such as jaw or back pain, nausea, shortness of breath. They may even be less likely to seek medical help because they don't even realize that they're having them. Care is about the same when a doctor suspects a heart attack. One of the first steps is to perform an angiogram, which looks for blocked arteries. But they may miss a type of heart disease that's more common in women called coronary microvascular disease, which damages the smaller arteries in the heart and don't necessarily show up. So men or women who've had a heart attack should be prescribed medication to protect their heart, such as low-dose aspirin, as well as blood pressure and cholesterol-lowering drugs, and be referred to an exercise program as well as counseling for rehab. The other thing that is more common in women but deadlier in men is depression. We don't think of a depressed person as being fatal, but women are about twice as likely as men to be diagnosed with depression because the hormone change in women is much greater than men, but men are much more likely to commit suicide. Women attempt suicide more, but men use more lethal means. So the symptoms can be more difficult to recognize depression in men because it often appears not as a sadness, but as complaints of being tired and irritable or loss of interest in their work or hobbies. Much of that might be due to cultural experiences of just how men think they should behave. When I grew up, men were not allowed to cry. Men were not allowed to have negative thoughts. You were always the person who took care of the family, and that was your job. So, and though depressed women are more likely to overeat, men tend to lose their appetite and drop weight. Men also may use drugs and alcohol to self-medicate and mask the signs of the depression. So women probably respond better than men when it comes to taking antidepressants, and in either gender, the SSRIs, or those are what we call the serotonin reuptake inhibitors, and in either gender they've been linked to sexual side effects such as erection problems in men and libido, and if that's a concern, there are alternatives to take. And getting a man to take them is a lot more difficult than a woman because of the side effects. We're going to take a break, and when we come back, we're going to talk a little bit about smoking cessation. Is it harder for women to quit than men? And how does the care differ, or does it? Hi, I'm Bill Kearney from Northlake Medical Pharmacies, and recently I spent some time with some of the students in Mrs. Goodwin's third grade class at Lakeport Elementary School to discuss the importance of taking vitamins. I asked the students, why is it important to take your vitamins, and here's what they had to say.
They give us big, strong muscles. They make us healthy. They help us grow tall. They're good for our eyes. They help us fight cold. They are good for our heart. They are good for our hair. They are good for our teeth. They give us strong bones.
Northlake Medical Pharmacy, a good neighbor pharmacy, is offering a Healthy Kids free vitamin program to the kids of Lake County. Any child aged 2 to 12 can receive a free 30-day supply of children's chewable multivitamins every month for a year. Simply sign up your children at either of our two locations at 347 Lakeport Boulevard in front of the Bruno Shop Smart. Call 263-1328 or at 5136 Hill Road East across from Sutter Lakeside Hospital. Call 263-6192. The Healthy Kids free vitamin program at Northlake Medical Pharmacy.
Who was your hero when you were a kid? Whether it was Joe DiMaggio or Jackie Robinson,
Rosa Parks or Sally Ride.
Bogart or Brando.
You're just the right age to do something important that you can be remembered for.
Even if you're in your 50s, 60s, 70s, or beyond, you can register to become an organ and tissue donor.
Surprised? You shouldn't be.
Today, people of all ages and even with health conditions can sign up to donate the gift of life.
And it's so important. Every age, every ethnicity is needed.
If we all signed up, imagine the lives we could save.
The families we could help.
So whether you admire John Wayne or James Dean, Robert Redford or Roberto Clemente,
Elvis Presley or Ella Fitzgerald, do something important that could make a real difference and change lives.
get the facts today and register to become an organ donor.
Find out how at organdonor.gov or call 1-866-99-DONATE.
A message from the U.S. Department of Health and Human Services, Health Resources and Services Administration.
Grandpa, look what I got.
Wait till you see the bike we got for Sig. It is the coolest thing.
Hearing loss happens gradually with age, making it easy to ignore. Yet most older Americans aren't getting their hearing tested.
Dad, can you hear me?
Untreated hearing loss can keep your loved ones from enjoying what they cherish most. Don't let that happen. Speak up about hearing loss. You'll be glad you did. Brought to you by the American Speech Language Hearing Association.
Okay, here are 5 important reasons why your son or daughter should play a high school sport.
Number 1.
High school sports teach valuable life lessons like self-discipline, sportsmanship, and time management skills.
2.
Teens who play a high school sport have better grade point averages and fewer disciplinary problems.
Number 3.
High school sports help fight teen obesity and substance abuse.
Here's number 4.
High school sports provide wholesome, constructive after-school activity, perfect for today's families.
And number 5.
And high school sports are safer than ever before. Injury surveillance and research, better equipment, and the continuing education programs for coaches provided by state and national athletic associations have made high school sports safer than ever before.
This message presented by the California Interscholastic Federation and the California State Athletic Directors Association.
And we're back.
Okay, we were going to be talking about people stopping smoking and whether it was harder for women to quit than men, and it is. They're less likely than men to succeed at quitting smoking. One of the reasons may be that they don't respond as well to nicotine replacement methods, such as the gum or the patch. And we think for them, smoking is less about fulfilling a nicotine craving, but more about smelling or seeing the smoke, or even the social aspect of smoking with others. How symptoms differ: most women report suffering severe withdrawal symptoms such as depression and cravings, anxiety, difficult concentrating. If you're a menstruating woman and you're still having a period, time your quit day to your period. Withdrawal is often worse in the second half of the menstrual cycle. Among the drugs to help people stop smoking, Chantix works equally well in both genders, but the antidepressant bupropion seems less effective in women. So, excuse me. Alzheimer's, which we're seeing a lot more of now as people are living longer and growing older. About 2/3 of Americans with Alzheimer's are women. But that's probably because they live longer. There's a quicker onset in men, however. So Alzheimer's begins in men about the age of 60, a decade or so, which is 10 years earlier than in women, and it progresses a lot faster. The symptoms with men are less likely to have obvious memory loss, possibly because the brain's memory center is less likely to be affected by the disease. According to the Mayo Clinic, instead they'd be more likely to have behavioral symptoms such as aggressiveness and agitation. And we see that a lot in skilled nursing. When I was doing skilled nursing, when a husband or wife, husband would go in the hospital and a wife would come, he would be accusatory sometimes of her having an affair with somebody else, and there was nobody else. Women go through menopause before age 45, have a higher chance of developing the disease. So if somebody had a hysterectomy, say at age 30, they would be more likely to go into Alzheimer's earlier than women who didn't. The average age is about 51. Being overweight is more likely to contribute to the dementia in women than in men. Parkinson's disease, which is more likely in men than women, they don't know why, though some estrogen may have a protective effect in women. It's easier to miss the early stages of Parkinson's in women because they're less likely to get proper treatment. For example, they're 22% less likely to see a neurologist, and then they need more close monitoring with levodopa, which is the main drugs that's used. So we see things change as well as medication that affect women more than men. Beta blockers, which are used most usually for high blood pressure, and sometimes for essential tremor, for stage fright, because they are a tranquilizer on the heart. So when your heart is under stress or your body is under stress, this keeps your heart from reacting. In fact, when you're doing a stress test like you're going to have to do, Paul, and you're taking a beta blocker, many times they'll take you off that beta blocker because it lowers your heart rate down considerably. So if you're taking a beta blocker, they'll take you off of it before, because the goal in doing a stress test is to get your heartbeat up and see how your heart performs when the heartbeat is accelerated.
Sure.
If you can't accelerate the heartbeat, and many times you can on a beta blocker, they'll take it away. Those drugs prescribed for high blood pressure after a heart attack seem to have a stronger effect on women than on men, at least when they're exercising. So that's especially true for metoprolol, which is Lopressa or Toprol. So women taking the drugs may need to be monitored more closely, and they should also talk with the doctor about adjusting their exercise regimen just in case of that. Coumadin, which is used all the time for blood clots, and warfarin is the generic name. Women are more prone to internal bleeding from this powerful blood thinner, often prescribed for conditions that increase the risk of blood clots, such as abnormal heart rhythm. AFib is what we talk about a lot using warfarin. Now we have a lot of non-warfarin type drugs on the market, like Eliquis and various ones like this that are at work without having you take an INR, which is a lab test to determine what your clotting time is, or a ProTime. So conditions that increase the risk of blood clots, such as abnormal heart rhythm, may explain why women are less likely to stay on the potentially life-saving drug, and underscores the importance of careful monitoring while it's on this medication. Probably the least expensive medication to take for AFib, but one that requires monitoring more closely than any other medication. We can adjust the bleeding time with warfarin or Coumadin when we find out that you have a slow clotting time and it needs to be increased, or vice versa, by changing the dose. On the non-warfarin types of medications, if bleeding starts, it's much harder to stop. Now, you'll see the ads on television say less likely to cause bleeding, but what they don't tell you is if bleeding starts under that medication, it's much harder to stop that. So Zolpidem, which is Ambien, and it's generic. The Food and Drug Administration, if you remember, lowered the recommended dose for women for that sleep medication from 10 milligrams to 5 milligrams because it clears their system very slowly, increasing the risk of morning after effects such as driving impairment and other things that would happen with you that doesn't get out of your system. So it's important for you to observe that. Even if you think you need to take a full dose, just remember what happens when you do and the risks. So the other thing is alcohol with drugs, and what medications and alcohol don't mix. If you find anything that depresses the nervous system, These meds can cause problems when taken with alcohol. Anti-anxiety drugs such as Xanax or Valium or Ativan. You have an increased risk of dizziness and drowsiness and overdose, slowed or difficult breathing. If you remember, we talked about some time ago about all the heroin overdoses and all the oxycodone when people would go through rehab, and then they would start taking the same dose they were taking when they got out of rehab, and they relapsed, and they started taking the same dose they were taking before, and it killed them. The same thing can happen with anxiety medications. If you had built yourself up to 2 or 3 milligrams of Xanax, and all of a sudden, and you can get addicted to these drugs, and it's really harder to withdraw from benzodiazepines, which are Ativan and Xanax, and Valium, than it is to come off oxycodone. So you go back to that same dose and you're in trouble. Antihistamines, and we think those are safe, but now you have non-sedating antihistamines which are on the market, which do Zyrtec and the diphenhydramines and the chlorpheniramines, the old ones, have a tendency to cause you some sedation. You add alcohol to those and the same kind of situation happens. Excuse me. Some antibiotics, not very many, but have an increased risk of alcohol, and you don't think of these many times. Z-Pak. You have increased possibility of nausea, vomiting, and flushing, increased constipation from them, doxycycline, which is a cycline like tetracycline, only you take it less often, erythromycin, and of course Flagyl, which is metronidazole. And Flagyl treats a kind of bacteria that's encapsulated in a cell, and it's called an anaerobic bacteria, and it doesn't penetrate, most antibiotics do not penetrate that cell membrane. When you take Flagyl, it does penetrate that cell membrane, but there is an increased chance of having violent kinds of nausea and vomiting because years and years ago, and it's still on the market, there was a drug called Antabuse. And Antabuse was a drug that you took if you were an alcoholic and you wanted to stop drinking. And that was before they had mind drugs that helped get you through it. This drug caused you to get violently ill. So when you took a sip of whiskey or vodka or beer or wine, you would get violently ill. This drug metabolizes into that drug when you take it. So even though it has nothing to do with you drinking, the chances can be when you get a form of reaction from it, that it can be a violent reaction. So blood pressure drugs such as Catepril and nifedipine and diuretics can cause some problems. We don't always tell you not to drink with those drugs because they're calcium channel blockers. Normally they don't affect you, but they can. The Coumadin that we just talked about with alcohol, internal bleeding with occasional drinking, blood clots and strokes, because it thins your blood in a sense. Alcohol does. It moves more freely through the system and can get caught up in the plaque that we have inside those arteries. Cholesterol drugs such as statins, atorvastatin, simvastatin, again, nothing that you would realize except liver damage is a possibility. And it used to be when we would prescribe the statin medications, after 30 or 60 days, we would do a liver function test and find out if it would affect your liver at all. Now, about once a year, we do what we call an LFT, a liver function test, and test and see whether you have symptoms or not, whether or not there's been any elevation in your liver enzymes. And once you get off of that, if that is causing an elevation in those enzymes, once you discontinue using that statin, those liver enzymes rebound and are back to their normal levels again. So, just so you know, it's a possibility. And when a doctor asks to take an LFT or liver function test when you're on a statin, it's very justified. Muscle relaxants, again, remember what I said about anything that would cause your central nervous system to be depressed? A muscle relaxant can relax you, such as Soma or Flexeril. You get the dizziness, the drowsiness, the increased risk of seizures when you add alcohol to it. So just remember, when we put that sticker on, don't drink alcohol and may cause drowsiness, you're aware that there could be a side effect with that medication if you add alcohol. I don't think we need to tell you about opiates. You know that already. You'll see less and less people taking opiates, including yourself. If you have chronic pain, they're going to be less available as time goes on, and there will be substitutes that are maybe mechanical or another way to stimulate relief from pain receptors. Over-the-counter pain relievers such as non-steroidal anti-inflammatories, Tylenol. We talked briefly last week about Tylenol. If you take acetaminophen and have a glass of wine, there's a chance, a rare chance, but there's a chance that you could go into complete liver failure, and people have done it before. You think it's safe? Well, just think about your Norco. Now you've got an opiate and you've got acetaminophen, and then you're adding alcohol to it. You just increase your risk of something bad happening to you, although the odds are low, but there is still a possibility. And then the sleep drugs, such as Zolpidem and Sonata. It's not unusual at all. Anything that you're going to take to cause you to sleep better, and you combine alcohol with it. And I've talked to people about this a lot, because 90% of the time it doesn't happen, and then all of a sudden it does happen. And the people that are in the limelight in Hollywood are frequently people who take that risk, and they've done it for so long it doesn't bother them anymore. And then all of a sudden, both of those drugs kick in at the same time, and then you're really in trouble. So I know I've given you a lot of information over these things about gender differences and differences in medication with men and women, differences in diagnosis with men and women, differences in treatment with men and women, but it's something you really need to think about, because for years and years, we've treated both genders the same when it came to medication, and we're finding out there's a huge difference, and we will continue to find out more differences. You'll hear a lot in the near future about a more focus on using shorter courses of antibiotics. We used to tell people, and we still do, to take the full course of antibiotics, even if they feel better. Excuse me, and our explanation is this. When we told you to take 10 days worth of antibiotics and in 5 days you were doing fine, all the history indicates that you were your body was not ready to take over after 5 days, and you needed to take the extra 5 days to make sure that your immune system was up running on its own and didn't need that extra spurt of the antibiotic. Now more experts say shorter is better. Longer courses are actually more likely to lead to resistance, partly by increasing the normal flora inside our intestines. That's exposure to antibiotics. That short courses work as well for many infections. We're already starting to see the shift. Up to 10 days used to be the norm for uncomplicated bladder infections. And now we know that 3 days of Septra or trimethoprim is usually enough. Consider the type and severity of infections, antibiotic choice, and the patient, and many times they're going to discourage the long-time use of this because we're developing such a resistance to them. 5 days of antibiotics can be given instead of 10 to 14 days for many uncomplicated skin or kidney infections. For community-acquired pneumonia, it's usually okay to stop antibiotics after just 5 days if the patient hasn't had a fever to 2 to 3 days. But here again, we're putting the responsibility on you as a patient to communicate with your physician, and we don't see that happening. Remember, every day I tell you healthcare is changing, and you're going to have to be more and more responsible. At that point, 2 to 4 days is often all that's needed to treat bladder infections in most school-age kids without a fever instead of 7 to 14 days. But for strep throat, you need to continue to take the 10 days worth of penicillin or amoxicillin. The full course is needed to eradicate the bug. Now again, this really isn't your choice. And if you go to a doctor and said, I just listened to Bill Kearney on KXBX, and he's telling me that I don't have to take this antibiotic as long as you're prescribing it for me. That's not a wise thing to do. I was in a doctor's office in San Francisco yesterday, and I kept my mouth shut when he was telling my wife the things that she needed to know to treat her disease, as well as the medication that he was prescribing. And not saying that he wasn't right. I just know that I don't normally tell a physician that he or she is wrong. Antibiotics usually aren't required for bronchitis, and you're seeing more and more of that sinusitis, which is where your sinuses get filled up. They're even saying with pink eye, since those are typically viral, you don't necessarily need it anymore. I disagree with that. I've had a history of having conjunctivitis or that, and it's always responded to an antibiotic drop. Especially when you have symptoms, and say you're a child and you're going to school and you've got that red eye that's dripping, and you probably need 2 or 3 days of an antibiotic to at least clear it up so it doesn't look so bad. It's one of those things that shorter courses often work as well as longer courses for many of those infections, but it isn't for us to determine whether those infections are what kind of antibiotic is needed. When I was working in a hospital in the Army, I would make ward rounds with the physicians because we were in a field hospital and up in the mountains. And when we made rounds with the doctor, and they do these in bigger hospitals too, in the city and maybe out here at Sutter, you make rounds with the physician. The physician tells you what the condition is and what the diagnosis is, and then asks the pharmacist, what would you prescribe for this, or what do you have in your formulary? In the military, it was usually what's in your formulary, because we were not a full-fledged hospital, we were a field hospital, and we didn't have a lot of the fancy medications that they have today. So it's important to get the pharmacist's knowledge about what's available and whether or not we should prescribe it or not, knowing the conditions. And pharmacists, of course, throughout the country are becoming more and more prone to have that kind of information available and have the luxury of prescribing medications. Last thing we have is new warnings will raise questions about what to use for teething pain. A lot of you don't have children that are young anymore, but you have grandchildren, and the son and daughter come home and want to leave the child with you while they go to their family reunion or something, or their class reunion. They're getting a lot of reports of seizures and lethargy in the thing that we've always recommended, and that's Hyland's baby teething tablets. So they're going to be probably taking it off the market. What they advise, and this wasn't always effective for me as a father of twins, was gently massaging the baby's gums with a clean finger or offering something to chew on, such as a teething ring or a wet washcloth, and chilling them because they're cool. It has a numbing effect on them. They'd said discontinue using teething necklaces. There's no evidence they work and could lead to choking or strangulation. I don't even know what those are. And not to turn to local anesthetics such as benzocaine or lidocaine. They aren't likely to help, and the baby's drooling can quickly wash them away. And they can numb the mouth and interfere with swallowing. Back in my day, my alcoholic father would always use brandy or whiskey and rub on my gums, and it seemed to work. And I still like it today.
I was just gonna say I do the same thing to myself.
Yeah.
Every chance I get when I have a sore tooth, just
rub it on there.
Rub some whiskey on it.
So the benzocaine is actually linked to another kind of blood disease that leads to cyanosis and shortness of breath. And remember, all these things are to the extreme. Many of you as parents have used all of these things. Viscous lidocaine, which we use a lot for people who are having cancer radiation or something in the inside of their mouth is raw. The mucous membrane is linked to seizures and cardiac arrest and death in young kids, so that would not be the drug of choice. Actually, acetaminophen or ibuprofen instead, if a med is needed, is probably the drug of choice. So as medicine changes, we have to change with them and have to be assured that we're doing the right thing for our child. You will also see less codeine being prescribed for kids. It's metabolized to morphine by an enzyme that we have in there, so fast metabolic change can get toxic of morphine levels, so you won't see near as much prescriptions for pain or cough for kids. For mild to moderate pain, again, it's acetaminophen or ibuprofen. There's some evidence that the combination works better than the other. Remember, acetaminophen is an analgesic. Ibuprofen is a non-steroidal anti-inflammatory. So we would like to remind you we're Northlake Medical Pharmacies with two locations for you. The 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192 or outside the Bruno Shops Mart at 347 Lakeport Boulevard. Give us a call there at 263-1328. Thank you, Paul.
Thanks, Bill, and we'll see everybody back here again next Wednesday at 10 a.m. for Health Talk on AM 1270 and 96.5 FM KXBX. Lakeport.